BOMAC Talk with your virtual tailgate, offering our commentary on industry-specific information relevant to conversations being held for and by owners, managers, and administrators. Who is not talking about the current pandemic health concern? Though it's not the ideal tailgate, we have some thoughts and insight we would like to share from a management consulting standpoint. Each of the 12 industries we primarily serve have been impacted by the current pandemic health concern. There are none that have gone unscathed, finding themselves having to adjust operational plans, execute change management plans, and activate business continuity plans. Under the utmost scrutiny, some pre-existing processes are now being called inadequate for the current demand. The healthcare industry already had some specific operational processes that could be considered ineffective and inefficient. When scaled, those problems often overlooked could not be ignored. The key areas overhauled were healthcare industry operational pre-existing conditions. The problems were already there at a smaller scale and became amplified when put under the current distress. Drawing from real and recent experiences, I can briefly discuss the problem as it is understood and the value of the proposed solutions. Why is the new solution important? Why the solution may have been chosen, and what problem it may solve. Let's talk about the evolution of the doctor's visit, the doctor's appointment. Telehealth is the distribution of health-related services and information through electronic and telecommunication technologies. It also allows for remote, long distance, off-site, outpatient, and clinician contact, monitoring, and care. Communication with your doctor or family physician can be by secured email messaging, phone, or video, which saves a lot of time. I've been conversing with my family physician by secured email message for almost 2 years. I'm iron deficient anemic, I have an autoimmune disease, have uncommon allergies, and about a year or so ago was monitoring prediabetes and pre-high blood pressure conditions. I was able to monitor, manage, and improve my health conditions through secured email messaging with my family physician. Needless to say, I won't be gallivanting around the community. No, I'll be staying put inside. If by some means, God forbid, I become ill, I can send a secure message to my family physician who leads in the effort to schedule appointments, to conduct the required labs, to document further observations, and to provide continued discussion. In addition to opening up telehealth, house call care provided anywhere the health members are located is being made available. You are also able to converse with your family physician or a doctor by Skype or by some other video conferencing method, even by phone, without the penalties and the regular regulations stopping you from talking to your physician over a secured line or a secured messaging system. So check with your healthcare providers to see those options that are available to you specifically. Now let's talk a little bit about lab scheduling, testing, and billing. This past year, I went for my annual Well Woman's exam. During my doctor's visit, the medical assistant began to ask me if I wanted certain labs. She went down a laundry list to which I was not prepared to sort. I contended for the labs required to complete a comprehensive Well Woman's exam, whatever those might be. The medical assistant went back and forth several times, and my response was the same. When the doctor entered the room, he explained that the lab and doctor contract had these conditions that if there were labs not covered by our insurance, that they didn't want to become liable for payment, so they asked for consent prior to. The problem was I didn't know what labs I would need to complete a comprehensive Well Woman's exam, and it wasn't appropriate for me to research each one to qualify them during the doctor's office visit. I literally would need to get this list ahead of time, review it, and check with my insurance, then go to my doctor's office visit. I've been recently made aware in the last 5 years of this separate or surprise billing between the doctor's office and the entity performing the lab testing. I was already aware of the lag time between the two, the lab and the doctor's office. We are all aware of that, right? Some of the labs are on location and some are not. I had already adjusted my behavior to not taking or filling prescriptions that required lab work verification and that were based on educated guesswork. I would wait till my labs came back to see if the doctor would change his prescribed treatment or stand with his original diagnosis. Now, if you add the process, time lag, billing of a state agency, university, and or the CDC labs through your physician, all of this added to the prior, one can begin to see the management challenges. It is really pertinent for individuals to keep up with their personal health calendar and reports. Speaking of which, this is a good place to reemphasize that you should be collecting doctor's notes, lab reports, and other health-related documents for your personal record. I'm an advocate for collecting a copy, reviewing, and learning to read the lingo on your lab reports, personal health records, and electronic health records. I've discussed this before, along with problems with office management, extremely long work hours, and shortages of qualified healthcare professionals. By getting involved this way, I have been able to find errors in billing and reporting. I've been able to understand my personal health better and to take responsibility for it. And I've been able to compose a management solution response. With this new health concern, we are now hearing about possible shortages in supply chain products and personal protective equipment for healthcare workers, respirators, ventilators, and real estate for traditional beds. We have discussed this before. Physician facility trends are leaning towards shared and leased office spaces, a very unique situation that doesn't lend itself to intensive care, inpatient care, but outpatient care, or that which doesn't require hospitalization. So looking at the current solutions, now that we have outlined some of the known problems, most of which were pre-existing conditions prior to the current health concern, we can kind of understand the lab tests in general are capable of mobile site capacity, most acquiring real estate near, alongside, and within medical care offices, buildings, and community centers. The invention of the swab test and drive-up parking lot locations helped shorten the time to get tested, shorten the time to get results, open the congestion at medical centers, and eliminates the surprise billing narrative. At least that is the idea. The in-home care, off-site tents, and alternate locations for intensive care beds are in response of the lack of real estate for the demand caused by the current health concern, which could work. Stockpiling and ramping up manufacturing of those supply chain items that are a necessity for appropriate treatment, care, and protection of the patients and healthcare staff is important. This includes making sure in-home care patients have access to water, to food, and to treatment as it is prescribed or becomes available. So these efforts should produce a favorable result. Currently, there is not a cure or vaccine for the coronavirus. However, there are individuals who have recovered from the illness. Illness prevention, management, and appropriate attention are the themes of the current best practices encouraged by the health authorities, all of which is worth studying, following, and sharing. I'm so grateful to be able to share with you today. I'm sending my prayers and love in your direction for good health, spiritually, financially, emotionally, and physically. BOMAC Talk Virtual Tailgate Healthcare Management. We're tagging along. If you would like to continue this discussion one-on-one, connect via chat, video, or email. You can do so from our website. Self-schedule an appointment at www.urbanetek2.com. Select a day and time for us to have a conversation about your specific management needs in this area.